Come in.
Hi, I'm Anthony,
Hello.
and I'll be performing your bedside assessment today. May I see your armband? And can you tell me your name and date of birth?
Raymond Brennan, date of birth 8194.
All right. And I see his medical record number. The medical record number on his band is the same as the one that I have on my chart. I'm going to be right back with you. I'm going to wash my hands.
All right.
Right now, I'm washing my hands. All right. Now, sir, do you have any allergies?
Yes. I have an allergy to sulfur drugs and then to pollen.
So to drugs and environmental. Do you have any other allergies to latex or to tape
No.
or to food?
No.
No. Fantastic. Alrighty. So while I'm asking him these questions, I'm also noting his posture, whether or not his face is symmetrical. I am looking at his skin, which looks fantastic. There's no breaks in his skin, no lesions, no abrasions. Alright, and his tone of voice is well. He's not stressed out or anything. So we're going to continue the assessment as planned. I'm going to check your IV site, sir.
Okay.
Alright. There's no kinks in your IV site. That's good. We're going to check for some redness or swelling. There's none of that. We're going to look at the IV bag solution that's running. If it's prescribed, or if it is the one that's prescribed from the doctor, make sure that's correct and the flow rate's correct. And then we are also going to check his oxygen. Make sure that's the correct apparatus. Make sure that it is that there's no breaks in the skin where he has it. And we're also going to check for any kinks. And then we are going to check his urinary catheter. Do you have a urinary catheter?
Nope.
Our patient doesn't have a urinary catheter. So if he did, we would assess as accordingly. Now, sir, do you have any pain?
Yeah, in my knee.
In your knee? Now, what brings it out?
What brings it out?
Yeah,
What do you
when you do a movement, what movement brings it out?
Jumping.
Jumping. All right, what kind of feeling do you have there?
It's like a dull, throbbing pain.
Throbbing. Does anything make you feel better or worse?
I guess rest and ice make it feel better, and then basketball makes it worse.
And what's the duration that you have it?
Let's see. 3 weeks now.
In 3 weeks? Okay. And from a scale of 1 through 10, what would you rate your pain?
A 4.
A 4? Alright, sir. Alright, well, we're going to continue with the rest of our assessment. So I'm going to assess your hair. Have you had any loss of hair recently?
Mm-hmm.
No, we're just going to lightly palpate his hair, and he doesn't have any lice in there. Looks good. It looks appropriate for his age. Next, we are going to look at his skin. Skin is his temperature is appropriate. There's no abnormalities. We are going to see his skin tone, which is normal for his ethnicity. We're going to check the turgor, which there's no tenting. It goes back into place. And then we are going to look at his nails. And his nails, they look round, they're firm, there's no abnormalities. And we're going to check for capillary reflex, which the reflex is between 3 seconds. It comes back within 3 seconds. Next, we're going to check capillary reflex on his toes. They came back within 3 seconds. Then we're going to check for any edema, which there's no edema in your hands. I'm going to check your feet for edema, sir. There's no edema in his feet. All right, so next we are going to assess your eyes, sir. So, take this pen light. Now, can you look at that wall for me? I'm going to shine this bright light into your eyes. All right, I'm going to go to your other eye. Fantastic. So, in his eyes, I saw that his pupils were equal, reactive to light, or round and reactive to light. and they were accommodating. They were accommodating bilaterally. They were great. So, next I'm going to look at your conjunctiva. I'm just going to put my hands on your face, okay? Wow, they're pink and moist. I'm going to look at your nares. They are pink and moist as well. There's no drainage. Can I have you open your mouth for me, sir? Let's see, oral mucosa and oropharynx are pink and moist. Can I have you smile for me? So his face is symmetrical. And I don't see any breaks in his skin, no abrasions, no lesions. And his ears are, there's no abnormalities in his ears. They're symmetrical. And he can hear me speak when I ask him questions, so there are no problems, no abnormalities with his hearing. Next, we are going to auscultate. We're going to assess your lung sounds. Do you have any problems when you breathe, sir?
Mm-mm.
No? Fantastic. So, normally we would assess straight on the skin, but for the purpose of this video, we're just going to assess his shirt. Now, sir, I'm going to check for your breath sounds. Also, his breathing is the rise in his chest bilaterally is symmetrical. So I'm going to auscultate his back using the Greek key pattern. All right. Breathe in. So lung sounds, when auscultated, they were clear. No adventitious lung sounds were heard. All right. Next, I am going to assess your cardiac system. I am going to touch your carotids. Okay. We're going to feel for the thrill. No thrill. I didn't feel any thrill while we're here. I'm going to pick up my stethoscope. I shouldn't have placed it on the ground. I'm going to auscultate with the bell for any bruits. No bruits were heard. Next, I am going to assess your pulses, sir.
My pulse? Okay.
So, I'm just going to check his radial pulse, then we're going to check his dorsalis pedis pulses. And his pulses are +2 bilaterally. And now we're going to check for his heart sounds. This heart sound, right now I am doing the aortic heart sound. The aortic in the second intercostal of the right sternal border. And then I'm going to do the pulmonic, which is at the second intercostal space of the left sternal border. Then I'm going to go to the Erb's point, which is at the third intercostal space of the left sternal border. Then I am going to go to the tricuspid, which is at the fourth intercostal space at the left sternal border. Then I'm going to go to the mitral valve, which is on the left sternal border, the fifth intercostal of the midclavicular line. S1 and S2 were present. Now I'm going to auscultate with the bell. And S1 and S2 sounds are still present. No other sounds were heard. Next, I am going to assess your gastrointestinal system. Can I just have you lay down for me, sir?
Yep.
All right. And may I lift up your shirt?
Yeah, I got you.
Thank you. Now, he doesn't have any breaks in his skin. There are no abrasions. Now I'm going to auscultate your abdomen in 4 quadrants. I'm going to listen for bowel sounds. Bowel sounds are present. If they weren't present, then I would have listened to each quadrant for 5 minutes until I heard some bowel sounds. Now I'm going to assess his aortic valve, aorta, or aortic, which I didn't hear any bruise.
Good. That's good.
Fantastic. No bruise. Fantastic, sir. Next, I'm going to palpate his abdomen. Now, just let me know if you feel any pain, okay?
Okay.
Using the one-handed technique. Feel any pain, sir?
Nah.
I'm not noting any tenderness. There's nothing hard here. Next, I'm going to do the two-handed technique. How does that feel, sir?
It's okay. No pain.
No pain. No pain. Now, do you have any dietary restrictions?
Nah.
How was your last bowel movement?
This morning.
Yeah?
Mm-hmm.
No abnormalities with it?
Nope.
Wasn't liquidy or anything?
A-okay.
A-okay. Fantastic. So, sir, I'll just have you sit up again. Alright. Next, I'm going to assess your gastrourinary system. When's the last time you urinated?
10 minutes ago.
Fantastic. So, did you feel any kind of burning?
Mm-mm. No.
Great. So, at this point, I would assess his intake and output. Next, I will assess his extremities for strength. Can you put this down? Oops. Can you push up against my hand? Great. Now, push down. Great. Now, push up against my hands with your feet bilaterally, and then push down. Great. His strengths bilaterally are strong. A +5. All right. Next, that's it.
That's it?
All right. Well, sir, it's been good assessing you. Is there anything else I can do for you? Would you like... Here, let me take your collet.
Yeah.
Where's your
thank
dominant
you.
hand?
I'm a lefty.
You're a lefty? Here.
Thanks.
Here's the collet. I put the collet in his hand. We're going to put his bed in the lowest position. Okay. Anything else we can do for you, sir?
No.
All right. Well, I'm going to go wash my hands. I'm going to see my way out of here, and the assessment is complete.
Bye.